Welcome guys, I'm Ron Ozuna. I'm the Assistant Dean and Assistant Clinical Professor for the University of Houston College of Pharmacy. I'm also the Clinical Pharmacist at DHR Health. And we're going to go over pharmacy, the pharmacy profession. This is something that's been around for a long time, but we've evolved to a very progressive type of career and something that you students may actually be interested in as a future profession down the road. What I wanted to do first of all is kind of show you a quick timeline of what what pharmacy looks like in terms of a course throughout a career. Right now, if you look at the slide, you're looking at yourselves in your high school years. You're a graduate. You're about to graduate from high school. If you're seniors and you're ready to go into college, pharmacy is a 6-year program. It's actually a program that entails an undergraduate process or timeline and then a graduate timeline. So if you look at the slide, you can see that the arrow that's pointing to the high school area is where you're currently at. Once you graduate from high school, you can go through 2 different paths. One path is going to do your undergraduate at your respective college and complete 2 years of your undergraduate degree, and then be able to process you through pharmacy school for your additional 4 years of the graduate program. There's the other process where you can actually go through your full bachelor's degree and get your bachelor's degree within your respective college as well. Complete your bachelor's degree and then push you through pharmacy school after you've completed your bachelor's degree. So there's a pathway that gets you there a little quicker through a 6-year program with just meeting your undergraduate prerequisites, if you will. And then those that want to get a bachelor's degree and then push forward into the pharmacy degree can actually complete both of those processes. There's another program that we have with STC that focuses on a pre-pharmacy cooperative. It's a pre-pharmacy cooperative program that allows you to get accepted into pharmacy school as a graduating senior. This is a little too late for those that are already seniors, but anybody that's earlier, juniors, sophomores, and freshmen can potentially get into this pre-pharmacy cooperative program with the University of Houston during their first semester of college. So if you are attending STC, you can actually, during your first semester of college, inquire with your advisors and see if you're actually eligible for this pre-pharmacy cooperative program to get you into pharmacy school a little early. This is our DHR team. We have a team of about 30 pharmacists and about 60 pharmacy technicians, and we all work integrated within our facility. What I'm wanting to show here is that you normally don't see this out in the community. When you think of pharmacy as a career, you think of pharmacists behind the counter at H-E-B, Walmart, things of that sort. These are the clinical pharmacists that are actually working within a facility. So I work at DHR Health, and these are my clinical pharmacists along with our director that work within the facility to address medication-related issues and problems within the patient population that we serve. So what do pharmacists do? We do more than just count pills. I think the stereotype for pharmacists, again, is that picture, and it's that community pharmacist that's out there providing the education and things like that at H-E-B and Walmart, which do a tremendous job of educating our population. But we do more than that. We actually educate our population, we educate our physicians, we educate our nursing staff, we educate multiple disciplines throughout the community to be able to optimize the therapy that we do for our patients. Here's a short list of the things that we do. We verify and dispense medications, which we do at the community level and in the hospital level as well. We educate and consult our patients. We consult our physicians. We consult our nursing staff and give direct patient education within the facility as well as we go into patients' rooms and we educate our patients on meds that they're going home on that they might be taking firsthand, first time ever. So we educate those patients that have those medications that they're not familiar with. We vaccinate patients as well. We have pharmacists that have certifications to vaccinate our population. And this is very critical at this particular time as we're looking for vaccinations during this COVID-19 time. where pharmacists are actually community advisors and assistants in providing vaccinations to our population to prevent these types of viruses and infections. We also make interventions with our healthcare providers. So when we're kind of walking around the facility and doing our what we call multidisciplinary rounds with physicians and nurses, we're making drug changes and things like that with our patients. So our patients are optimized, and actually their medication therapy is optimized with some of the changes that we do with our healthcare providers. And there's a lot of our physicians that really rely on the pharmacist to be right next to them when we're rounding within our respective patient care units to make those decisions that will make things better from a medication standpoint for our patients. And we work with specialty populations. I'm an infectious disease pharmacist, so I work with our infectious disease doctors, and we go around and we kind of look at the different infection types for our patients, and then we optimize the antibiotics and antivirals and antifungals that we use for our patient population based on their renal function, hepatic function, things of that sort. There's times that physicians will actually consult the pharmacist in the facility where we're consulted, and we go and we educate our population or our patients, and we make changes on medications by protocol, which we call protocol, which physicians are automatically giving us the authority to make the changes on certain meds. So that's pretty interesting. There's other disciplines and specialty populations that we focus on, and that's cardiology, oncology, and pediatrics. There's also areas of management that we focus on. So like our pharmacy director, he's a manager, and he manages all of our clinical and operational team that is composed of about 30 pharmacists and about 60 technicians. So you can go into management, which looks at the economics and the economic impact that we're having as pharmacy for not only the facility but the community at large. So management is also a possibility. I'm the pharmacy clinical manager, so I have about 10 clinical pharmacists that work under me, and I help coordinate where they go and what they do and develop policy and procedures for us to be able to manage our patient population well. And then we do much more, which I'll describe in a little bit. The careers in pharmacy, I think that's a big thing, is what can we do? I kind of outlined what we do on a daily basis and what we're doing with our other disciplines with our physicians and our nurses. But there's specific areas of practice that we focus on as well. And one of those is institutional pharmacy. That's where I work at. I work at a hospital. So that's one area of practice that we can focus on. Clinical pharmacy is exactly what I do within the hospital. And this can be done at clinics, it can be done at physician offices. Clinical pharmacy is where the physician has given you the authority to make certain changes in under certain protocol for patients, and be able to utilize that authority to optimize therapy for the patients. We have pharmacists that work under this clinical pharmacist title that also have prescriptive authority. So they're able to write prescriptions, give the prescriptions over to the patients, they assess the patients, they give the prescription over to the patients, and then those patients are able to head to the pharmacy and fill those prescriptions. So that's pretty interesting, because that's the evolution that we've gone to, is from just being able to dispense the medication to now we're actually writing the medication, optimizing orders and prescriptions for patients, and then actually being able to write the prescriptions for the patients to go out and fill. So we're making a huge impact throughout the evolution of our career and our profession. We also do retail, and what we consider retail pharmacy is community pharmacy, and those are the pharmacists that you see in the community working at H-E-B, Walmart, and CVS, which is a stereotypical pharmacy picture. And those pharmacists do a tremendous job on the outpatient side too, where they assess patients, they also vaccinate patients, they dispense, and they educate their patient population on how best to take their medication. There's also compounding pharmacists that actually take powders and liquids and all of this and put them all together, and they compound them specifically for the patient and make those patient-specific medications available to them. And even the retail pharmacists that are in practice now, Walmart, H-E-B, and the independent pharmacies, will do quite a bit of compounding throughout their day to make sure that their medications are appropriate for their patients. Ambulatory care, we have some pharmacists that work in ambulatory care, and those are really clinics where Now patients are coming into the clinic to see the pharmacist as they would to come in and see the physician. So when they come in and they see the pharmacist will evaluate their medications, make dose adjustments on their medications, make sure that it's optimized, and then they're able to go home and monitor their care. So ultimately, the pharmacist is monitoring their care throughout their stay, and then we'll refer back and forth to the physician on any changes that need to be made with that patient. But that patient generally is the pharmacist patient, and the pharmacist is able to take care of that patient as best as they can. And then there's academia, which is the other area of practice in pharmacy. In academia, and I'm also a part of the academic part as assistant dean and assistant clinical professor for the University of Houston, is where we actually teach our students. So if you do plan on having pharmacy be a career and a particular option for those that are interested, you will go through pharmacy school. Well, we teach those pharmacy students. So we have in general about anywhere between 12 and 15 students in a given year that come and hit DHR Health. And us as preceptors and part of the academic process, we educate them, and we ultimately utilize them within our integrated processes to get them through their curriculum. So I'll talk about kind of where your years go in pharmacy, but your fourth year of pharmacy is specifically that of clinical activities. So you're literally in different rotation sites, practicing side by side a pharmacist, and learning the operations and learning the clinical activities that the pharmacists do. So throughout that entire last year, you're literally working as a clinician, as a student, as an intern, side by side one of those clinicians. So that's pretty fun to do as well, and we take part in that throughout our daily activities. Many different areas of practices in hospital pharmacy. Ultimately, we verify things. There's an IV room. A lot of our medications in the hospital are IV. They're injectables. They're those medications that have to go through the IV. Ultimately, the patients that hit our hospital are those that are really sick and can't take anything by mouth. So the big crux of our activities in a given day in the hospital, from a technician standpoint and from a pharmacy standpoint, is to compound and mix those medications that are important for those patients that are on the floor. And a lot of those are injectables. So we have an IV room, we have a compounding area, and then we have multiple areas again where we practice throughout the different floors of the hospital to be able to ensure that those medications that we're making for them, because we literally have to make them and put them together, and which we call compounding, make sure that those are appropriate for our patient population. And then we talked about clinical pharmacists in the different areas that we practice: infectious disease, transplant, cardiology, pediatrics, and a whole bunch of different areas where our clinical pharmacists are not behind a computer in a central area like you see in the community. They're actually up on the floor. And if you look at the slide here, you can see that the pharmacist there is the one on the far left, the closest to the camera, along with the intern that's right next to him, and they're working as a team to be able to incorporate the best treatment for our patients while we're on the unit. So you don't see any medications on the shelves there, you don't see any automation, you don't see any technicians running around trying to fill and count pills. All you see is a pharmacist there with an intern and the medical team and the nursing team trying to make decisions for our patients on the unit. Retail, retail pharmacy is ultimately the thing that we look at and what we see from a community standpoint. And a big thing there is our counseling and our education of our patients. I think that's primary in the retail setting. The education that we give our patient population in those particular settings is optimal. It decreases med events, side effects when we educate our patients and tell them how to take their medications well. So that happens a lot on the retail side. Compounding, again, we talked about a little bit about that. We not only compound in the hospital setting, but we also compound in the retail setting and making medications that are specific to patients, making tablets into liquids, making liquids into suspensions, making suppositories that are specific for pediatric populations. So there's a lot of compounding that goes on within the retail and the hospital setting. And then ambulatory and outpatient, we talked about that, and it's educating our patients. We talked about how clinical pharmacists are able to make decisions for patients now, and patients are actually coming to see our clinical pharmacists in the ambulatory setting. And as that area of practice grows, we're going to see more pharmacists in clinics and in physician offices making decisions and seeing patients and being able to make those prescriptions and hand those prescriptions out to our patients. Academia is the last one that we kind of pointed to, and a lot of that happens between our interns that come into our facility, but there's also advanced training that we provide for our pharmacy, in the pharmacy career. So after you get your pharmacy degree, your PharmD degree, you don't necessarily have to stop there. There's what we call residencies, okay? Once you become a doctor of pharmacy, you can push forward into an additional 1 or 2 years of practice, even a fellowship in certain areas, where you can get advanced training and become an advanced clinician in those specific disciplines that we talked about. So we provide the education to the residents that have actually matched with our program. We have 4 resident positions at DHR Health, and we educate them and we teach them for an entire year and get them prepared for advanced training. And these are already practicing pharmacists that are wanting that advanced education and advanced training. And myself as a resident director and Bridget, our resident director for the other positions, we help coordinate that education and that training for our residents that come and hit our facilities. So that's pretty good, is that the career is growing and we're evolving more as a medical/clinical team. So the real big thing is, how do I get there? I kind of talked about the different areas of practice and what you can do and what we do in those areas of practice, and just to give you a quick superficial view of it. But how do I get there? How do I get admitted to pharmacy school, and what can I do now as a high school student that's preparing for college to get ready for pharmacy school? We talked about the different paths, okay? Number 1 is go and get 2 years of prerequisites, and then you're able, with a specific GPA and being competitive, you apply to pharmacy school. The other path is to get a bachelor's degree or an undergraduate degree, get your 4 years, get your bachelor's degree, and then apply once you meet the specific requirements for it. The other way is, right now as a high school student, which might be a fast track for you, is during your first semester, actually about your first year at STC, you can apply to pharmacy school at the University of Houston, because there's that affiliation with STC. So you maintain a good grade point average, you take your prerequisites, and you apply to the University of Houston, and you're able to get in. You still have to complete the additional year of prerequisites before you get into pharmacy school, but you're already admitted. And I think that's a really good program and a good pathway for those that are interested and truly interested in pharmacy. And that's through the STC network program. So looking at your application requirements, you generally, again, will need about 2 to 3 years of prerequisite coursework. So that's your undergraduate coursework of about 2 years. And remember, through STC, you have, during that first year, you can actually apply to the University of Houston College of Pharmacy and potentially get admitted if you're competitive. You do need letters of recommendation, so it would be good to get to know your pharmacy and medical network already as high school students. Get to know some of your nurses, some of your pharmacists, some of your physicians. Get to volunteer. You can actually volunteer at DHR Health or volunteer at any of your facilities near your area, and get some volunteer work under your belt. That's community service. Okay, get some of that volunteer work in there, and start to build that network with your clinical team, because those are the individuals that will write letters of recommendation for you, that will speak well of you, your work ethic, your communication, your professionalism, etc., that will make you competitive to get into pharmacy school. There's also another requirement, that is your PCAT. So before getting into pharmacy school, during your application process, you will have to take an entrance exam, and that's your pharmacy entrance exam, and that's your PCAT. Okay, and you have to do well there, but that generally will focus on math, science, some of your sociology and psychology areas. But generally math and science is a big crux of that entrance exam. And most of the individuals that have about 2 to 3 years of prereqs or have gone through their undergraduate degree do very, very well on their PCAT. But the PCAT is important because that gets the door open for you to be competitive in the application process. And then community service. Make sure you put in your community service with your church, with your organizations, any clubs that you're doing in high school. Jot all of that down, keep a log of that, and make sure that you put that into your resume when you're applying into pharmacy school, because that makes you very competitive. Not only looking at the grades, we're looking at the entire individual. So if you're good at everything that you're doing outside of not only your coursework, you could be a very competitive candidate for pharmacy school. Your prereq coursework, you can look at this slide. It's generally biology, microbiology, genetics, chemistry 1, organic. You do some math, calculus, and statistics. You do a little bit of physics, and then we talked about psychology and sociology as well. One thing that I really will emphasize in your coursework is your communication. English course is really good. The way that you communicate, not only verbally but written, is hugely important with how we view and assess a candidate that's coming into pharmacy school. So, requiring essays and presentations and things like that are important to get into pharmacy school. So when you're applying, there's also letters and things like that and essays that you have to write. So we're looking at that written communication that's important. So English is hugely important as a prerequisite as well. And those are generally part of your core requirements when you're completing a bachelor's degree. So once you complete your bachelor's, you generally would have all of these requirements to get into pharmacy school. 3 letters of recommendation are required. We talked about letters of recommendation. Generally, you want your pharmacist or healthcare professional to help you with those. You start building that network as we talked about. A college professor could be a great person for letters of recommendation. A high school teacher would be an excellent letter of recommendation as well if you're applying early through any of the early programs. Your employer, your supervisor, or your pre-health faculty advisor, anybody that's been advising you throughout your curriculum is perfect individuals that would suffice the letters of recommendation. And then community service. Generally, the community service is about 25 hours at least of community service beginning during your college years. So start thinking of where you want to put your time in outside of school to be able to meet these requirements that ultimately make a candidate competitive. So start looking at your church groups, your clubs, things like that you can actually help out in outside of school to be able to make you competitive. And then of course your PCAT. Make sure that when the PCAT comes around, that you're looking at review courses for it and how to study for it, and then that you're preparing for it well, because the PCAT does play a huge role along with your grades and your GPA to get into pharmacy school. And then what can you do now as high school students? Again, just in a nutshell, to make yourself competitive is take your math and your science courses. And again, I pinpoint not only math and science, but English is important. Do well in your written communication as well as your verbal communication. Get involved in presentations and things like that. Get in front of people. That's important, because when you get to the pharmacy admissions piece, there's also an interview that you're going to have to go through. And in that interview, you want to be able to communicate well and be able to show how genuine you are and how passionate you are about the pharmacy profession. Join health professions and science clubs. We talked about the community service, so that's a big piece there. You can actually do that. If you haven't done that, do that during your first, as soon as you get into your college in the fall. So start looking for your health professions and your science clubs that you can start to put in some of your time. Learn about the college requirements. I kind of gave you guys a little glimpse of what the college requirements are. So be prepared for those requirements, which are your biologies, your sciences, your maths, your physics, and your and your Englishes and sociologies and psychologies. So know what the curriculum looks like so that you're able to target those courses and do well, as those are the prereqs that we're looking at, and that's the GPA that we're looking at to get you into pharmacy school. Meet pharmacists around you, I think, is important. So go to your community pharmacies. If you're picking up meds at a specific pharmacy, get to meet your pharmacist. These are individuals who are going to be resources for you to be able to give you information and continue to make you competitive for pharmacy school. So meet your pharmacists, meet physicians, meet nurses, meet healthcare professionals that are going to give you maybe some of the behind the scenes type of advice to get you into pharmacy school and make you competitive. Develop good study skills is the other thing. If you don't have them now, please develop them now. The pharmacy curriculum is rigorous and it's tough. There's a lot of volume that you have to cover in a short amount of time. So if you have good study skills and discipline, I think you're going to do perfectly fine. And then visit your college campuses. Visit the different college campuses for undergraduate as you're completing your prereqs, and also visit your colleges of pharmacy throughout the state. There's about 11 pharmacy schools in the state that you can choose from, and they're all unique. So go and feel comfortable with the college that you're selecting when you're selecting a pharmacy school. So go and, if you're able to, go and visit those colleges. As DHR Health, we're privileged to be here local, to be able to be a resource for you. So if you're looking at the University of Houston College of Pharmacy, we're resources for you here at DHR Health. All you have to do is call our pharmacy and get a hold of our UHCOP team, which includes me, and we'd be able to provide you information and guidance through that. And not only for the University of Houston, but any college that you're willing to research. So again, visit your colleges and be there. So just kind of gave you a surface view of what pharmacy is, what the areas of pharmacy are, and what it takes to become a pharmacist. Wish you well in your decision making, and if there's anything that we can do from our standpoint, feel free to reach out to us as we're resources here locally for you to help you get to that next step. Thank you very much.